Hi, I'm Dr. Stacy Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk today a little bit about a Baker's cyst. I get that commonly asked me, what is a Baker's cyst? A Baker's cyst is a collection of fluid that occurs on the back side of your knee, typically in the very back portion of your knee. And people will feel fluid, they'll feel that their knee feels tight, and sometimes you can even feel a soft tissue mass that's located in that area. And if you have that, typically it's a Baker's cyst. It could be another diagnosis, but very commonly if you have those symptoms, it is a Baker's cyst. It is typically associated with knee arthritis. So people that have knee arthritis develop Baker's cyst very commonly. And the reason the Baker's cyst occurs is because when you have knee arthritis that gets flared up, your knee creates a lot of fluid, and the fluid tends to accumulate in the back of the knee, which kind of pooches out in the back, and you can feel it and see it, and that is a Baker's cyst. Baker's cysts will kind of come and go. Sometimes they get bigger, sometimes they get smaller. Typically their size is related to the flare-up of your knee arthritis. So if you're undergoing a knee arthritis flare-up where your knee is hurting, the knee tends to produce fluid. The fluid goes to the back of the knee and then produces this Baker's cyst. Now, the Baker's cyst may change in size based on if your knee arthritis is flaring up or not. How do you treat a Baker's cyst? Well, it starts with treating the underlying condition, which is the arthritis. So the arthritis can be treated through oral anti-inflammatory medications, a cortisone injection, a hyaluronic acid injection. There's some other treatments that we do in the office that involve injections that can help reduce an osteoarthritic flare-up. So important to know, you treat the underlying cause, which then causes the osteoarthritis flare-up to become reduced, which reduces the amount of swelling, which will then reduce the size of the Baker's cyst. Surgical treatment is not a good option for actually going in and surgically removing the cyst, because the cyst is not the reason you have the Baker's cyst. So if you cut out the Baker's cyst, but you don't treat the cause of the Baker's cyst, a new one will reform. So treatment for Baker's cyst involves treating the cause of the cyst, which is commonly from knee osteoarthritis. On occasion, we do see Baker's cyst when people have a meniscal tear that can also cause the fluid in the back of the knee, and that would be treated with surgery for the meniscus. And typically treating the meniscal tear takes away the swelling, which then reduces the Baker's cyst.